sure that's as much of the draw as you're dying to find out what we want to tell you today. My name is Patricia Martine. I'm the Director of York Housing Authority. My sidekick, Laura, is doing the administrative part of the program that we'll talk to you about today. I wanted to give you a little bit of background because there's a few connections in the community that kind of made this possible. York Housing, as some of you or all of you may know, we've been taking care of elders in the housing way since 1982. Providing affordable housing solutions, we're now able to support those of all income levels, market and middle income and low income, so people can stay with us for a long time. Over the years, what we learned was that there was more to it than that. There were other things that needed to be looked at and other needs that needed to be met. So with the evolution of that came transportation, a meal program, housekeeping, a menu of services. We have a garden group, a salon. All of that is at minimum cost and bought as needed. So it's $3 for a ride to the grocery store and $5 for lunch and those kinds of things. So by doing that and incorporating that in our independent living, we've been pretty much meeting people's needs. The thing that evolved, though, over time and was a wonderful relationship with York Hospital, who meets a lot of your medical needs. Judd Knox, the president of the hospital, who is seated back there in that pink shirt, has been on our board of directors for many years. I don't even know anymore how many it is. It's just there. He's just there. And he's taken the lead in many instances. We have a wonderful network of volunteer board members throughout those years, but Judd has been a constant. And he and I have looked at two sides of elder care. One is shelter, the other is health. And in thinking about what needs to be done, we realized that we couldn't have enough facility. We couldn't build enough houses to meet the need. So the next best thing would be to take the act on the road. Hence what we call our neighborhood network. It is York Hospital Services, a network of, and York Housing, home repairs, and social services, and various and sundry other things that you could dream up that we can do for you. The Neighborhood Network is a membership program, and with that membership comes some volunteers, some vetted vendors, and our expertise in knowing how to problem solve for whatever it is you could possibly dream up that would allow you to stay in your own home as you age. It's a one-number contact, and with that comes someone at the other end of the phone that says, what can we do for you? If you, and this is for someone who's 50 and over, so it is not simply end-of-life medical needs, although that is part of the solution. But if you're staying in your home, you need a good, reputable person or persons or companies to take care of your home, to do the home repairs, to make sure that it's safe, to simply give you the idea that when you call someone, they're going to come there with a reasonable price, and they're going to have been looked at by us and also interviewed by us You will know that their background checks and sex offender registries and all of those issues have already been dealt with. So you don't have to think, who is this person knocking at my door? The nice thing that we have incorporated into this program is that we will be using our own maintenance team to do the small repairs. Large things like roofs and bigger projects, we will refer you to a vendor. But for a $25 an hour cost, you will be able to call and say, I need somebody to come fix my sink. Those kinds of things go with the network. We feel that this is something whose time has come. There are various versions of this networking kind of thing that's going on throughout the country. We were fortunate enough to have Judd and myself and my assistant actually visited Beacon Hill Village. Some of you heard about that, possibly. 60 Minutes did some PR on it. It's a group of people in Boston that got together in a neighborhood and they decided that they didn't want to leave their neighborhood, so they were going to organize and help each other out. They started the first one several years ago, and it was so interesting to folks that people began asking them, how'd you do it, how'd you do it, how'd you do it? And so they developed a village-to-village program, which is on a computer, where all of the people that are developing these villages and these neighborhoods throughout the country can get the resources, so nobody's reinventing the wheel. But the idea of aging and staying home is actually an option. If you, example, you come home from the hospital, you've had knee surgery. You have 6 weeks, you need to be careful. You can't walk your dog. You call us. We'll find somebody to volunteer to walk your dog. So that's not home repair, but that's how intricate and varied the services can be. It's all personalized. It's, you know, you can't get your trash to the road. You can't get your porch shoveled. You need us to recommend someone to plow your driveway. We can do all of that, every bit of it. All you have to do is call our number and speak with one person. And that's our neighborhood network. And I assume that there will be questions, so we always try to, actually, Laura, do you want to talk a little bit about,
Yeah, just
Did I get carried away?
you covered everything very well. I'm sorry. But I'm Laura Taylor. I'm working with Patricia.
I forget, she's behind
And
me, usually she's next to me.
Yeah, this room is a little more. I've been working with York Housing for a couple of years doing financial stuff, and we're now taking this on as well, helping to get the neighborhood network off the ground. And we're doing a lot of these public meetings, and there have been mailers that have gone out. You may have seen some of our material. Hopefully you're starting to recognize we have a logo and a look and a brand and lots of stuff up here. So we're laying the groundwork for really having the opportunity to sit down and have one-on-one individual conversations with people who want to stay in their homes and would like to talk to us. So I just thought a show of hands, maybe just to start with, how many of you own your own home? And you're living currently in your own home? How many of you would like to just stay there right straight through? Okay.
Nice, we like that.
And that's what we want to make possible. There are, as Patricia was describing, these villages all over the country that are doing things in different ways. They're sort of hybrids. Some work with hospitals, as we are in partnership. Some of them are more like homeowner associations with neighborhoods. Some are very rural and where transportation is a huge issue. Lots of different things. But here, what it is basically, I like to think about is it's bringing community resources together. It brings volunteers into the picture to help out and make things affordable for people. Certain types of needs you might have a volunteer. We've already seen that. We have people in Kittery and New York who've asked us for help on things like fixing lamps. We happen to have a volunteer who is kind of a man of all trades, and he has done air conditioner installation for people. He's done his lamp repair, always willing to help. And so our volunteer piece is going to be really, really important in this. And so part of what we're doing in these public meetings is inviting people who are interested in volunteering to do just some suggested companionship, going in and spending an hour or two a day with one of our members. Doing a daily phone call to check and see how they're doing, possibly pet care, pet walking, as Patricia said, or small repair and handyman type jobs. So that's the volunteer piece. We know and expect that some of these needs that you have, that our members have, are going to be beyond that. And so the vendor network that we're putting together will be very valuable as well. So we're also looking for people to provide us with recommendations for vendors that you have doing things for you that you think would be, that you would recommend and you think might be good to for us to contact and bring into this picture as well. So we have vendors, we have volunteers, and we have our members. And it's a community and everybody's working together. So that's the basic premise of the whole thing. Membership benefits, there are several. We tried to kind of summarize them with these adjectives. Independence is key. You stay in your own home, you decide what you need, when you need it. If you're not sure, we're on the end of the phone to talk to you and kind of problem solve and figure out what you might need today and into the future. So safety and security and peace of mind are all kind of those wonderful attributes that if you are going to have somebody come to your home to do a job, well, you'd sure like to know who they are and what their story is and what do they do, what they say, and are they going to charge you a fair price? All of that is part of what we do with our vetting of vendors. We do the criminal background checks and all of that stuff. So we take care of that. Our piece of problem solving is a big one. We don't even know all the things that people are going to need. We're learning every time we talk to another person. Every time we have a conversation, everybody's unique. So we really want to be there for them to come and ask, and we'll work it out. There are so many resources out there, and just knowing what they are, keeping up with them, the changes that are happening with Medicare and with home services in general, we want to be on top of that and get really, really well educated and informed on all of those things that we can offer. Convenience, choice, again, it's all right there in your home. You pick up the phone, and we have one number you call, and we're going to talk to you, whatever. We also, well, actually first, affordability. So we haven't talked about what this costs yet. There are a couple of different options. We have a charter membership that you get the full services, everything we have to offer is $35 a month. We provide volunteers for as many of the services as we can, and then we look for the best price for you for the services that we're not able to offer. One of, as Patricia mentioned, one of our best offerings that we really have is our maintenance crew at York Housing. They are all experienced technicians doing repairs for our residents in their apartments, so they know the kinds of things that are going to come up. And they're very good working with the aging population. They're wonderful, wonderful guys and very helpful. We also have at York Housing this whole component of resident services. We have programs for our residents. We're opening those up to our members as well. Things like we have a book club, we have a cribbage club, we have a little movie club that meets on Tuesday afternoons every week. We're showing musicals this summer. We have our meals program, which is provided by York Hospital, wonderful, that we have over in our community building at Baldwin Center. We're adding lots of things, and we want to have members involved with that as well. You might want to start a little travel group or a little dining out club where a group of people go together to restaurants in the area. These are the kinds of things that we've seen the other villages doing. Cultural events and museums and concerts, and really trying to bring all that into it. And that's something we're working on. Also, vendor discounts with local businesses. We're really going to work hard to team up with our businesses and get the discounts for different things around town in the communities. So there's a lot of value, definitely a lot of value in this program, and it can change with you as your needs change. So you might not feel that you need a whole lot in the beginning, but when you buy into the membership, it's there for you to decide what you need as you go along. The connection with York Hospital is a huge plus. York Hospital has so many services they provide their patients. When they leave the hospital, there are, if you have York Hospital doctors, you can get transportation to your appointments. You can take advantage of the meals program also at the hospital and the prescription service delivery. So all kinds of things that we're working with York Hospital to provide. So that's really all I wanted to say. We gave you a little, hopefully short questionnaire so we could get a sense of where you all are as far as thinking about doing something like this. Whether you'd like us to talk to you one-on-one, we'd love to do that. Lots of ways to contact us.
Could you speak more about the vendor vetting process, particularly getting references and speaking to them about their fees?
Yep. So we have put out feelers to get some vendors in, and we've had a number of them come to us. We have a very extensive vetting questionnaire that asks them everything we want to know, plus information we need in order to do background checks. We ask them for 3 references. We call the references. We have a whole interview with the reference, the recommendations. The pricing, we have a conversation with them about the reasonableness of their prices. We don't set prices with them. But the way we're hoping to ensure that the prices are fair is that we will be following up after every service call with our members to make sure that things don't go out of line. But the recommendations that we get include value for the money. That's something that's really important to us. And personality is also very important. How patient people are and how reliable they are answering the calls.
We are meeting with them, doing interviews with each vendor.
Yeah,
So we sit down with them, and if we don't feel that they're appropriate for the population, they don't have the right level of compassion required to do this type of service, then we would not be interested. So it's more than just, can you do the work? It's the whole comfort level that you should have with someone who's working in your home.
Another thing I left out, actually, the benefits. When you sign up to be a member, we will arrange with you to come to your home and do a one-on-one or two-on-one individual consultation with you. Take a look around your house, talk to you about any concerns you have, what's going well, what needs doing, what might need fixing, safety issues around the house, trip, fall hazards, things like that. Start that conversation with you so that we can kind of get a baseline of where you might be and where your concerns are, so we can work on helping you with anything that you might need help with. We will bring one of our service technicians with us to that meeting, and he'll go around the outside and the interior of the house and take a look at things, smoke detectors, dryer vents, all the building-related things that
PA systems, etc., just to get an idea.
and that's complimentary, there's no charge for that.
Are your services limited to York residents? Or?
Actually, we are servicing 6 communities, which are the communities that York Hospital has established its presence in. So we have York, Kittery, Elliott, South Berwick, Wells, and Agunquit. So we're really pretty broad, widening our reach. I have a list here. I don't want to overwhelm you with having this list out, but handyman services for all kinds of light home repair, technical services, your computer, your TV, your cell phone, all that stuff. Transportation, whether it's getting around town to the Hannaford or the Rite Aid or wherever you shop, or it might be a ride to the airport when you want to be dropped off. These are the kinds of things that we're working on arranging.
The volunteers will be
Volunteers
doing
will
a
be
lot
big
of
on that.
those types of things.
Yep. Landscaping, gardening, weeding, plowing, shoveling, whatever happens outside and around your house. I mentioned the book club and food and meals. Maybe you want to try Meals on Wheels or the hospital home delivery program. Or maybe you need help planning your meals. Maybe you need somebody to come in and get you set up for the day, morning and evening meal, something like that. Light housekeeping. Got a lot of people who have worked at York Housing doing a beautiful job for our residents, and they're going to branch into this as well. Paperwork, like bill paying, organizing stuff, insurance stuff. We're not experts in insurance, but we have, for instance, a
Vendors.
volunteer, and we have vendors, but volunteer who stepped forward. I think he lives in Elliott, who has worked with a lot of friends and family members and is really good at working through that stuff. And then there's the whole sort of the wellness, yoga, massage, all that good stuff, Tai Chi, maybe. Educational and cultural events. We're going to have a speaker series we're going to try to introduce, just keeping abreast of all of the things that are going on in aging. We have a little coffee clash that we're doing on the first and third Wednesdays of every month at the Baldwin Center. Coffee and goodies. And individual conversations or group discussions, whatever sort of involves. So that's the first and third Wednesdays of the month. Yes.
Once you're a member, how do you communicate all of this ever-changing scene of membership?
Good question. We have a few ways in which we communicate. In fact, I have copies of our newsletters right here. So we have a paper newsletter that goes out once a month. It's pretty short and sweet, but it includes the calendar of activities and description of some of the special programs that we're doing. There's also an article in this particular one about the York Housing maintenance piece that we're adding onto our program. We also have everything on a website, very, hopefully, easy to use, and we'll continue to make easier to use. It's actually designed by the Beacon Hill Village in concert with the technology company too. So we can do vendor referrals on that, we can do volunteer sign-ups, you can register for events, you can go into our vendor database and look someone up if you want to find an electrician yourself or what have you. So that's, and then there's of course email, we do e-blasts or the newsletter. So it's tailored to what you might find comfortable for yourself.
Other questions? Yes,
How
ma'am.
do you fit in with the senior center?
Oh, you did very nicely. Yes, we have actually, we've already started working on kind of getting the word out through York Senior Center, the Wells Senior Center, South Berwick, and Kittery, and Elliott. Actually, all the communities we've gone in Algonquin. And had meetings, and we have their newsletters, we have all the information that they can provide to the community. We have that access to that as well. So we're like a hub, I think, is what we hope we are, with lots of connection points to resources, whatever they may be. And every day, several times a day, you hear new things that are happening, and it's exciting to be in that place where we're kind of catching all of that cool stuff. So, the associate membership. So the full membership, I told you, was $35 a month. We like to have a full year's membership paid, so that's $420 for a year for an individual. It's $600 for a couple. You could also do that in 6-month increments. If you prefer to try it out, we're happy to do that. We're very flexible about that. We're not out to get a lot of money out of this by any means. But we have another different kind of membership that we call an associate membership, which is $10 a month, so it's $120 a year. And that entitles you to access to that website and the database and all the resources that are there that will continue to be enhanced. So you can go in there and find the vetted vendors. You can go in there. You basically have access to everything except the volunteer piece. The volunteer piece is something that we're reserving for our paid members.
Our full membership.
They're all paid members if you will. Full membership, yeah.
So we hope by doing this that we will be able to address some of the issues that people and that we've learned. I mean, we know that isolation happens in our housing situation. We know that some individuals prefer to not join social events and not do things. But even with that, they have someone next door. They have a neighbor that is, a walk down the hallway. When you live alone, that's not always so simple. So the isolation piece is with our volunteers, visiting members, with them being able to not worry about driving and being able to get around the community for their needs. We feel like we bring them back into the fold, and they can have a full life and not feel like they are out navigating the world and all the things that come up. And I'm not reflecting on the news, but it's hard to notice and not become fearful. And so this, we hope, will be a connection for you. I think if you meet us, you'll get to know our staff. You will feel confident with the fact that, we've landed in a good place. We are also serving the people that are on our wait list, that are waiting to get in their housing. For our market rents, there are people that have to sell their homes, and there's a 2-year wait. So if they're coming in and they're finding it difficult to maintain their homes, there's a window of opportunity there that we can help them feel comfortable while the process is taking place, while they're waiting for an apartment in any of the communities or senior living situations. So that's a little bit of a niche too for us. All we can do is grow with this. We're not looking to do anything more than cover the expenses of the network itself, the staff, and those kinds of things with the fees that we're charging. We're a nonprofit, both the network and your housing authority, so we have a mission to supply services, housing, and our staff is all of that mindset, so you have a comfort level with that as well. And that's our network. The best thing you can do for us is to fill out that little paper that we gave you, and tell someone about it. Tell someone what you heard today. If you have neighbors, or if you would like to have a gathering and you have a little neighborhood of people that are all kind of in the same situation, we'll come to you. We will meet with 6 or 8 people on somebody's front porch, and we'll talk about what might be accomplished. So don't be shy about sharing what you've heard today, and call Judd. His number's published.
Absolutely do, yeah. I have business cards on here with all that information. Our brochures, yes, that's a great place to go to get every information you might need. As Patricia was talking, I was just thinking that what has made this concept of the village so successful across the country is really it's been very grassroots kind of growth. So it's about the members deciding what they want and asking for what they want and working with us to create the various programs that they might want. So that's where you come in. Help us plant seeds and water them and start this thing going.
Thank you very much.
Thank you. Thank you for appreciate that.
And I was kidding, don't apologize.
Anyone have any questions right now?